What is HIRARC? HIRARC is conceived of hazard identification, risk assessment, and risk control. Hazard identification is the recognition of a thing which may cause injury or harm to a person. Risk assessment is looking at the possibility of injury or harm occurring to a person if exposed to a hazard, while risk control is the introduction of measurement which will eliminate or reduce the risk of a person being exposed to a hazard. The purpose of HIRARC: to identify type of hazard in the work area, to make risk assessment, to suggest, implement, and review risk control.
Situation 1. On the bench, we can see the workspace is messy and disorganized. Identified hazard is improper handling of laboratory equipment. Based on situation 1, there is a higher risk of apparatus or equipment falling from hand, or might be cut or injuries by broken glassware. Next is danger. Exposed to the broken glassware can lead to hand injury, more serious injuries such as puncture wounds. Other than that, might expose to germs due to unclean and messy workspace. Next is control. It is essential to conduct in a safe work procedures by maintaining a hygienic practice, organizing properly and ensure to clean the bench before begin any activities.
Next situation is the exposure to hazardous chemicals in laboratory. The hazard is sulfuric acid. In this video, we can see that the workers do not wear gloves and lab coat properly and doing the experiment at inappropriate places. So, the risk can cause the destructive to skin, eyes, teeth, and lungs, such as irritation eye, severe skin burns, and teeth erosion. The danger is the exposure to hazardous gases of sulfuric acid. Therefore, we need to have precaution or controls to prevent the workers from getting hurt. Safety glasses, lab coats, gloves must be worn when working in, on, around the fume hood. They also must put their head beyond the sash opening.
Third hazard is cuts and lacerations, which are common workplace injuries. Among the hazards illustrated in the video are working with dull bloods, which is unsuitable tool for the task, insufficient light, and failing to wear PPE. Cuts and lacerations pose a risk of injuries ranging from minor abrasions to severe ones, such as puncture wounds and deep lacerations. The potential danger caused by the blades is a small cut that can lead to an infection, while a large cut can result in profuse bleeding if not treated properly and appropriately. For the control, we recommend to use the appropriate tools, educate team members on how to use cutting and shearing tools properly. When not in use, store sharp objects and tools safely. After all, we must wear the required PPE including gloves, lab coats, and masks.
Next, the last situation is the electrical hazard. The hazard is contact with exposed wire and contact with high voltage electric. In this video, we can see that the worker do not drying her hand properly after washing them and then turn on the switch. So, the risk may cause cardiac arrest, minor or major burn, and difficulty breathing. Then, the danger is turn on switch with wet hands will resulted in electric shock as water is a good conductor of electricity. Lastly, we need precaution and control to avoid this hazard by drying hands thoroughly with tissue after washing them to avoid any accident occurring.